Okay, so most of us have experienced some form of anxiety this year. Generally, adults might be able to handle things a little better, but our children don't necessarily have the same coping skills. If you suspect your child is struggling with anxiety, there could be a larger mental health issue going on. I spoke with Roy Hollis, CEO of Houston Behavioral Health Care Hospital, about what signs to look for and how to get help. Roy, a lot of people associate mental illness with adults, but in reality, children deal with it. And oftentimes what you see in adulthood actually got its foothold in childhood.
What children deal with is similar to what adults deal with, but children don't have quite the tools and the experience to deal with those in a good way sometimes.
Yeah, and because there's not a one-size-fits-all, because there are different origins of mental illness, different types of mental illness, is the reason why you need to deal with experts like you all. What are some of the causes of mental illness in children in particular?
There's a physical component to it. Sometimes physical illnesses can cause some mental health issues. But I think overall it's the same thing. You know, they have stress in their everyday life. There's school, there's trying to maneuver in a world sometimes away from parents that is difficult for them. They don't necessarily have all of the experience that we have. Sometimes trauma. Things happen in children's lives. Sometimes they're minor but important to children, and sometimes they're the larger things: loss of a friend, divorce, death of a parent, grandparent, sibling. All of those things can be very traumatic for children, and they can cause some mental health issues.
And oftentimes parents will delay getting help because it might look like just being a teenager in some cases, right? We know that's kind of a rocky time for a lot of kids. Let's go through some of the signs and symptoms that should basically make parents just aware that they might need to ask some extra questions.
Okay. I think sometimes with children it's kind of tricky because symptoms can sneak up on you. You might notice things, difference in the way they sleep. Either they sleep too much, more than usual, or not getting enough sleep. Nightmares, being more sensitive sometimes to other people around them in that they cry or they get upset more easily, distancing themselves from their friends and their normal activities. They may have enjoyed baseball in the past, but suddenly they don't. Changes in dietary habits, eating more than usual or not eating at all. And sometimes you don't necessarily notice those all at one time.
When it comes to needing help, the first thing we need to do is remove any idea of shame, because this is one of those things that I would imagine the earlier you have some intervention, a lot more things can get done. So let's first remove the shame. A lot of people deal with this.
It's not only admitting or thinking to yourself that my child has a mental illness. There's a lot of shame that goes with ourselves too. A shame that maybe we failed our child in some way, or that we're not able to protect our child or provide for them. So there's a lot of self-shame that goes into dealing with a child who has a mental illness, as well as dealing with the what people may think, or ugly comments from parents or other children that they know. So there are a lot of shame issues and guilt in that.
Yeah, and knowing that you don't have to go through this alone, and in this case, just talking to them and being there for them may not be enough. All right, a lot of times we'll see kids who have that mental break show up in a hospital, right? You know, in an emergency ward. And what you want people to understand, this is Houston Behavioral Health Care Hospital. Yes. This is what you do, right? So you understand the full components of this. So explain how specialized this hospital is.
If you feel like you need help with your child or just want to ask questions, you can call our intake department number and someone will speak to you about what's going on with your child. If you need more than just being able to speak to someone on the phone, then they can set up a session or an interview with a psychiatrist to talk to the child and to you as a parent and try to figure out what's the best course to take for your child. If it's severe enough, if the child is at risk of harming themselves, then certainly inpatient would be an option. And in inpatient, the child is protected. They would be in a children's unit away from adults, only with other children, approximately their same age. They would have group therapy during the day, twice a day, recreation therapy to try to learn how to deal with stress. They would meet with their psychiatrist. There are always nurses available 24 hours a day on the unit, the patient care unit. Family therapy is another option that we have with all children. We do family therapy. You have to treat the family as a whole with children. If it's not inpatient that they need, then we have two different types of outpatient service. One is PHP, called partial hospitalization, or PHP, and that's a more intensive outpatient program. The patient is in group therapy all day. There would be family therapy with that. Or then there's the lesser intensive therapy, which is just regular outpatient. It's not as time intensive as the other. They may only attend 3 days a week. We work it with, we're able to work with the schools on the time of day that we offer that service so that the child doesn't miss any more school than they have to. And so there's all types of different levels of care that we provide, and then to refer the patient to aftercare after they leave one of our programs.
All right. You mentioned the 24/7 no-cost assessment line. We'll give that number in just a second. But the other thing that is so critical is that insurance can get involved in this. We know there was a time when we didn't feel like insurance really paid enough attention to mental health. That is changing.
It is. And you know, Medicaid, all insurance plans pay for behavioral health treatment for children. So it's covered across the board.
Roy, thank you very much. I know that a lot of people's ears perked up when they heard this because it is a confusing time in a child's life, and these are much more confusing times right now.
Absolutely.
If your child needs help, get in touch with Houston Behavioral Healthcare Hospital today. That 24/7 no-cost assessment line again is 832-834-7720. That's 832-834-7720, or you can visit them online at houstonbehavioralhealth.com.